Update on Zika virus infection from the Ministry of Health. Pursuant to the news release dated September 16, 2016, which stated that the Federation has 3 confirmed cases of Zika virus, this serves to provide information on the infection. The Caribbean Public Health Agency, CARPHA, is monitoring the Zika virus epidemic in the Latin America and Caribbean region, and recently indicated an overall downward trend in the number of cases of Zika virus infection. However, this would not be the case for the newly affected territory like our federation, where you will be seeing new cases at this time. It is important to emphasize that there is an overall decline in the number of cases in the region, and there is no need for alarm. What is Zika virus infection? This illness is caused by a virus from the flavivirus genus. It is important to note that most or about 70 to 80% of infected persons will not experience symptoms. Symptoms appear 3 to 12 days after the bite of an infected mosquito. This disease is characterized mainly by a rash, along with a low-grade fever, redness of the eyes, muscle pains, joint pains, and headache. Symptoms are usually mild and last 2 to 7 days. How does Zika affect pregnancy? Pregnant females are particularly vulnerable because if infected by the Zika virus during pregnancy, they have an increased risk of miscarriages, offspring with abnormally small head or microcephaly, and other adverse pregnancy outcomes. What are the complications of Zika virus? Well, the complications are rare. A small number of infected persons may develop the complication Guillain-Barré syndrome, which is a rare condition marked by inflammation of peripheral nerves in the body that control movement and nerves responsible for sensation and feelings of pain. The global incidence of Guillain-Barré syndrome is 1 to 4 cases per 100,000 annually. Persons with Guillain-Barré syndrome usually experience tingling and pins and needle sensations in the legs and or arms, muscle weakness, loss of sensation, and sometimes inability to walk. Persons with any of these symptoms should seek medical care urgently because early treatment makes a difference in outcome. How is Zika virus transmitted? Locally, Zika virus is mainly transmitted by the Aedes aegypti mosquitoes. These mosquitoes live near people in and around homes, schools, and workplaces. They are daytime biters, and their peak hours for biting humans are early to mid-morning and before dusk in the evenings. However, they can bite at any time. These mosquitoes typically lay eggs in stagnant, clean water in buckets, bowls, dish drainers, refrigerator drip pans, drums, old tires, flower pot saucers, vases, animal dishes, water bowls for pets, drains, and gutters. The mosquito become infected after they feed on persons already infected with the Zika virus. The infected mosquito then spreads the virus to other persons through bites. There is no cure for this disease, and there are no vaccines available as yet to prevent it. Treatment is primarily symptomatic. Persons affected by this disease should seek medical care, especially all infected pregnant females, children under 5 years, and older adults 65 years and over. Affected pregnant females should attend scheduled antenatal clinic appointments. all other pregnant females without symptoms are also advised to keep their antenatal clinic appointments, whereby they will be monitored for possible Zika virus exposure. All men are advised to use barrier protection at every sexual encounter. How can individuals protect themselves from Zika virus? Well, all infected persons are especially advised to protect themselves from mosquito bites for at least the first week of illness, using personal protection measures in order to reduce the risk of human to mosquito to human transmission. Personal prevention measures include application of safe insect repellents like OFF that contains DEET or diethyl toluamide. This repellent may be applied to skin or clothes and should be used according to label instructions. Wear light clothes. Wear light-colored clothes that cover as much of the body as possible. Use physical barriers, like closing your windows and doors in the early morning and evening hours. Use mesh screens and mosquito nets. Eliminate mosquito breeding sites inside and outside your house. All pregnant females should follow strict measures to prevent mosquito bites and should even consult their healthcare provider for advice. All pregnant females should practice safer sex, including the use of condoms or abstaining throughout pregnancy to protect the unborn child. Public health measures. Since earlier this year, our Ministry of Health embarked on an integrated vector control program, including the following strategies and measures. The first strategy, health education, which involves health educational activities like presentations at schools and distribution of brochures to increase public awareness about the need to eliminate mosquito breeding sites. The second strategy is that of source reduction, which involves visit to communities to inspect premises in order to eliminate mosquito breeding sites. The third strategy, OV trapping, which involves the setting of traps to determine hotspots, which in turn guides the decision for fogging. This measure also facilitates routine collection of mosquito eggs for resistance testing. The fourth strategy is that of chemical control. This strategy is two-pronged and involves 1, larviciding, which is the application of insecticide called Timophos or abate to stagnant water, and 2, fogging or spraying with the insecticide called Control 4. This eliminates adult mosquitoes. However, this has been delayed. The fifth strategy is that of biological control, which involves the use of fish to consume mosquito larvae in collections of water. And the sixth strategy is port surveillance, in which WHO procedures are followed to prevent the importation and exportation of diseases. OV traps and adult mosquito traps are also positioned at all 3 ports of entry. The placement of adult mosquito traps is done with assistance from Ross University. All imported tires are also fumigated. The way forward. In order to control the local Zika virus outbreak, the above measures must be continued, and most importantly, we must be aggressive in eliminating all mosquito breeding sites. No Aedes aegypti mosquito means no Zika virus infection. To achieve this, you and I must be active in eliminating mosquito breeding sites in and around our homes. This will also require community efforts to rid common areas of mosquito breeding sites. This will require a national effort involving government ministries and the private sector. Remember, no Aedes aegypti mosquito means no Zika virus infection. Let's come together and eliminate all mosquito breeding sites.